My name is Andrea Walker. I am a family nurse practitioner with my Doctor of Nursing Practice degree, and I am the owner of Dr. Andrea's Medical and Weight Loss Clinic, located at 8317 Cordova Road, Suite 201 in Cordova, Tennessee, 38016. I wanted to just tell you a little bit about our weight loss options, and you can always call us, and I highly encourage you to call us for a detailed consultation over the phone prior to your arrival. Our number is 901-552-3518. But to get started, we have three main weight loss options as far as appetite suppressants. So the first one is a pill. Most people have heard of Phentermine. It is a control substance. What Phentermine is going to do is it's basically going to suppress your appetite. So when you, if we decide to put you on Phentermine, we're going to run a baseline EKG on you. We're going to get your height and weight. Your BMI must be at least 27. For most patients, it's going to be 30, but it just depends. If you have high blood pressure, diabetes, cholesterol, then it can be 27. After we get your height, weight, we're going to run a baseline EKG. If all of that comes back normal, you'll leave out with your medication. Some people will do what we call our triple whammy. And what that is then triple, of course, 3. That means that's Phentermine, and then you can add on Topamax or Topiramate. That's the same medicine. People just tend to call it Topamax. That's the brand name, but the medicine is actually Topiramate, which is the generic name. What Topiramate does is it's going to give you additional weight loss because it makes the Phentermine work even better, and then it causes its own weight loss. And then the third option is a shot. That shot is recommended weekly, we have a couple of choices. Basically, they're lipotropic shots, so you can do either our Vitachrome, which is it's basically vitamins and amino acids, but the big part of it is the chromate or chromium, which is going to help with carb cravings. The other one is BioBoost. So you do one or the other. You do either Vitachrome or BioBoost. BioBoost doesn't have the actual chromium in it. But they basically both have the aminos in it, and they have a fat burner. BioBoost is going to have a stronger fat burner in it. It's not going to make your heart race. It's not going to make you jittery or anything like that. It's not like a pre-workout, but it's great whether you work out or not. They both have B12 in them, so they will get, a lot of people do call them energy shots. So sometimes people say, which one should I get? The big difference is, do you crave a lot of carbs and eat a lot of junk? If you do, I would say go with Vitachrome. If you don't, then go with BioBoost. So you don't have to get all three. Sometimes people get just Phentermine and Topamax. Sometimes people get just Phentermine and BioBoost. Sometimes people get all three, which is what we call our triple whammy. So that's option number 1 for our weight loss program. Option number 2 is what we call our GLP-1, which is Semaglutide. A lot of people know it as Ozempic or Wegovy. We actually call it Semaglutide. So if you call us and you say, do you have Ozempic? We're going to say, no, we don't have Ozempic. Ozempic is the brand name, and you can only get that at a, retail pharmacy like Walgreens. So we do use compounding pharmacies. We use legit compounding pharmacies. You don't have to worry about that. Everything we do here is legit. We've been open since 2017. The program is a 20-week program. You can stay on it as little or as long as you want. And just to go back to Phentermine, Phentermine is indicated for short-term use. However, Semaglutide, and I will get into Tirzepatide, but both of those are for chronic use. They are approved for chronic use. So Semaglutide, even though I said it's a 20-week program, you can stay on it for as little or as long as you want, but I highly suggest you give it the full 20 weeks. What it does, and it's going to basically suppress your appetite by delaying the gastric emptying of your stomach contents. So it is a weekly shot. Every 4 weeks, you have the option to go up in the dose. You do not have to come in the clinic every week. You can take these shots home. We do offer what we call take-home shots. And we do serve the entire state of Tennessee with our Semaglutide and with our Tirzepatide. We do not serve the entire state of Tennessee with Phentermine because you do need to come into the office for your first visit. Semaglutide is a little bit different. We can ship those to you because it's not a controlled substance. So just kind of FYI, if you live in Knoxville or Pigeon Forge or anywhere in Tennessee, we can ship those Semaglutide and Tirzepatide to you. Just FYI. But anyhow, let's move on to Tirzepatide, and then I'm going to come back to, I'm going to talk about Semaglutide and Tirzepatide together. Now, as far as Tirzepatide, it is what we call a GIP and a GLP-1. And a lot of people know that one as Mounjaro or Zepbound, but we will call it Tirzepatide. Same thing if you call us and say, do we offer Mounjaro, or a lot of patients will call and say, hey, I was on Mounjaro, but I can't get it at my pharmacy. Can I come to you and get Tirzepatide? We will say yes. Or if you call us and say, do you have Mounjaro? We will say we don't offer the Mounjaro, but we do offer the generic version of Tirzepatide, and we get it from a compounding pharmacy. Are you okay with that? Most patients will say yes, or they don't really understand it, and we will explain what that actually means. But it's a 24-week program. But again, you can stay on it as little or as long as you want. Same thing, it's a weekly shot. The dose goes up every 4 weeks. You don't have to go up every 4 weeks, but when you come into the clinic or when it's time for you to go up, we will say you have the option to go up what you like to. Now, to talk about both Semaglutide and Tirzepatide together, depending on which one you're on, you would be on one or the other. They both do delay this gastric emptying of your stomach contents. And there are really, with all three of these, Phentermine, Semaglutide, and Tirzepatide, we're going to get a detailed history of your past medical history, your family's medical history, what medications you're on, surgeries you're on. You do not have to have blood work for any of these. However, we do offer blood work. There are a few patients that I will say we do need to do blood work, or I need to know some of your blood work. Have you had blood work in the past 3 months? If there's questionable kidney disease and maybe you had some kidney problems, I need to know what your most recent labs are. You're not sure that you don't really have kidney disease, but you had some kidney problems. I need to know what's going on. So it's not 100% mandatory, but there are some times that I will say, let's do some blood work and just really see what's going on before we start you on this medicine. It's rare that happens, but it does happen. And sometimes patients will just say, can we get blood work? Yes, we can. Not a problem. We have the option to draw blood work here in this office. We do not accept insurance, just FYI, but we do accept if you have like a flex spending account or health savings account, we do accept that. So we are going to be very thorough. That's what makes us different. We don't rush you in or rush you out. One of the reasons I wanted to do this video is to go ahead and give you an idea of what to expect. We do want you to call us, even if you watch this video and you're like, hey, I want to go there. You don't have to call for a consultation, but even when you come in, we're still going to go over, you know, what to expect. We don't want you to leave out of here and not really know what's going on, what medicine you're on, and say you're not losing the weight you want to lose. We're going to say, hey, what are you eating? Are you working out? What's going on? Did you have a bad week? We're not going to make you feel bad. We just want you to be successful. We don't want you coming in here every week or once a month and not getting those results that you want. We don't want you to waste your money, because you could easily just come in, rush out, and weigh the same thing for month after month after month, or week after week after week. But what's the purpose? You came to us for a reason, which was obviously weight loss or to see some results. And that's what we want. That's why we're here. So that's what we want you to do. We want you to be successful. So that's basically our three options are, as far as true appetite suppressant weight loss, would be Phentermine. You could do our triple whammy. Semaglutide, we have the 20-week program, or Tirzepatide, which is the 24-week program. Again, we're going to get a history. I will go over the risk, the benefits, the expectations. A lot of times people are going to say, how much weight can I lose? I'll just throw these little numbers out here. Phentermine, the most I've seen in 1 week, and that was on the triple whammy, was we sell 14 pounds. You're not going to see that every week. I promise you, you don't want to see that every week. You don't want quick weight loss. As far as semaglutide and tirzepatide, the most I've seen, and this was in the first week, was about 12 to 13 pounds. You're not going to see that every week. I believe the most we've seen, period, on tirzepatide has been about 80 pounds, and the most I've seen on semaglutide has been around the same. I think it's 85 pounds. We do monitor you because there are risks involved. You don't want to develop pancreatitis. You don't want to lose the weight too quick. Some people want to lose weight quick. We don't want you to do that. We do offer other, some people just want to build muscle. Some people want to learn how to work out. I am an IFBB pro professional bodybuilder, so I know how to train you. I offer online training. If you suffer with carb cravings, I can help you with that. I have many options for that. I have a detox tea. I have a flat belly tea. If you look on our page, obviously, if you're watching this video, you're on our website. We have plenty of options. So definitely give us a call. We offer body contouring, which will help you lose inches, help you lose fat. We have sauna treatments. Sometimes people can't lose weight because of their hormones. So we offer hormone replacement therapy. It's bioidentical for men and women. Have options to help you actually build muscle, and anti-aging treatments, as well as meal plans. So call us 901-552-3518. Watch some of our YouTube videos. They mostly talk about semaglutide and tirzepatide, since that's the hot topic right now. Click on some of our links. You can click on Instagram, Facebook, YouTube. We hope to see you. Again, you can reach us at 901-552-3518. And we are located at 8317 Cordova Road, Suite 201 in Cordova, Tennessee. And we do ship throughout the state of Tennessee. Bye. Have a great day.